Alright, good day everybody. Our topic will be on the development of arteries. How does arteries develop? As we all know, the cardiovascular system is the first system in the human body to start functioning. The cardiovascular system includes the heart and arteries and then the veins. Okay, we're not talking about cardiovascular system. Development of the arteries. The development of the heart cannot be discussed in this video because it is way too big. We discussed in a separate video. So the pharyngeal arches form during the 4th and 5th week of development, and each arch receives its own cranial nerves, artery, and cartilage. As you can see, this is the artery, this is the nerve, and this is cartilage. And this is what pharyngeal arch. This is the pharyngeal pouch, this is the pharyngeal cleft. This pharyngeal pouch is formed from the endoderm, the cleft is formed from the ectoderm, and the arches itself is formed from the word mesoderm. These are the arches, the one in between. Okay. So formation of the aortic sac. How does the aortic sac develop? First of all, endocardial tubes appear. When this endocardial tube appears, what do? They have the ventral, the arc, and the dorsal parts. This is the ventral part. The ventral parts are going to fuse together. They are going to fuse together. They form the sac. Okay. So the remnant will now be the ascending, the arc, and the descending aorta. You can see, once they fuse together, they dilate, they divide. This is the aortic sac, truncus arteriosus, and this can be our sinus venosus. Okay. So the aortic sac, after the aortic sac forms, what happens? You see that we already have our first pair of primitive aorta. These are the first pair of primitive aorta coming off from the aortic sac. Okay. Now the 2nd to 6th pharyngeal arches are going to form too. They are going to form here. Yeah, there is going to be pouches, clefts, like I showed you before. There's going to be pouches, clefts. This is the aortic sac, and this is the pharyngeal arc. The pharyngeal arc. Look at it here. This is the pharyngeal pouch. Okay. So the 2nd to 6th pharyngeal arc is going to arise from the arc, which I showed you now. It's going to arise from there, pharyngeal arc, and they'll be connected ventrally to this aortic sac and dorsally to this dorsal aorta. This dorsal aorta. Now what is going to happen? Something is going to happen in order for this to actually look like the arterial system we have in the adult human body. The 5th arc, okay, we have 5 arches. We have 5, but we have the 1st, the 2nd, the 3rd, the 4th, and the 6th arch. The 5th arch either never forms, or when it forms, it degenerates. This 5th arch. It degenerates. So we have the 1st, 2nd, 3rd, 4th, and 6th aortic arches. These arteries supply the head, the neck, and the thorax. Note, it supplies the head, neck, and the thorax, and they are 5 in number. And what are they called? They are the 1st, the 2nd, the 3rd, the 4th, and the 6th pharyngeal arches, or the aortic arches, because the 5th one fails to develop or have regressed completely. By day 27, the 1st and the 2nd aortic arc is going to disappear. the first will disappear first. By day 27, the first is already disappeared or regressed, and it will remain to the remnants will be small, and that remnant will form the maxillary artery, blood supply to the maxilla. By day 29, the second would have disappeared. So by day 27, the first aortic arc would have disappeared, leaving behind a remnant known as maxillary artery. Whereas by day 29, both first and second have disappeared. The second will leave behind the hyoid and stapedial artery, the hyoid and stapedial arteries. Okay, the third and the fourth, remember the first and second are gone. So we have now the third and the fourth arc open into the ventral portion of the sac. The third and the fourth open into the ventral portion of the arc, whereas the sixth open into the dorsal portion. We'll see the reason why this happens. The third and the fourth aortic arc open into the ventral portion of this aortic sac, whereas the sixth will open behind. This aortic sac in the future will still divide, and you'll see what it gives rise to and why this sixth aortic arc has to open dorsally, not ventrally, like this third and fourth aortic arc. Blood supply from the pulmonary trunk passes only into the sixth aortic arc, pulmonary trunk artery. When we're talking of pulmonary, you know that we are talking about the lungs. We don't want mixing of the oxygenated and oxygenated blood. That is why we need to separate the blood in the pulmonary trunk. Remember, it's deoxygenated, and make sure it is only in the sixth arc artery, whereas that's of the ascending ureter, which should be oxygenated, is going to the third and fourth arc arteries. Changes of the arterial arches that produce the adult pattern. Okay, what really happens? What happens is that there are going to be some changes. Like I told this dorsal aorta, you see that this aortic sac has already bifurcated, and you can see that the third, this is the third and the fourth are connected to the ventral portion of this bifurcation, whereas the sixth is opening into the dorsal part. And I told you that we don't want mixing of oxygenated and deoxygenated blood. That's why it has to be separated at that point. Okay, what's going to happen in here is that first, the dorsal aorta will grow cranially. Dorsal aorta is going to be growing cranially beyond the point of attachment of the first and second aortic arches, which is not shown here. To grow cranially, that is number one. Then number two, this is going to be disappearing. The portion of dorsal aorta between the point of attachment of the third aortic arc and the point of attachment of the fourth aortic arc. So the portion of this dorsal aorta between these 2 points of attachment is going to disappear. Okay, and then the portion of the dorsal aorta, because these are dorsal aorta, all these things we have to dorsal aorta, but you will still see how it will regress, and we only have the left dorsal aorta that will give rise to our descending aorta. We don't want 2 descending aorta, we just have one. This guy is going to give it the left dorsal aorta. So this is the right, it's going to regress and all that. So this is the fourth aortic arc. The portion of the dorsal aorta where the fourth aortic arc is attached, and the portion where the right aortic arc fuses with the left, this is the left aortic arc. You see all these portions are going to disappear. It's going to regress. And okay, and that's it for this slide. At some point, as the changes is still occurring, what will happen? There will be a branching of from the sixth aortic arc. There will be a branching off from the sixth aortic arc. This branching off is a branch of this sixth aortic arc going to the developing long board. So it's going to branch off here. And remember, this is the right side and this is the left side. Okay, so at the right side, the portion of this dorsal aorta, or the portion of the sixth aortic arc that lies between its point of attachment to the dorsal aorta and the developing young board and the developing branch to the young long board is going to disappear. So this portion is going to disappear. Portion of the sixth aortic arc between its point of attachment to the dorsal aorta and the branching of the artery to the long board is going to disappear. Okay, in the right side, it's going to remain patent. It's not going to regress, and this patent side, red H, is going to become adductus arteriosus, which will later become the ligamentum arteriosus. Alright, it's going to form the ligamentum arteriosus. Alright, and this portion, ductus arteriosus, is responsible for carrying blood from the right ventricle to the dorsal aorta. Yes, it allows blood to be passed from the right ventricle to the dorsal aorta. Why? The reason for this is that as of then, the lungs is not inflated and hence it is not functional. Okay, it's not functional yet. Oxygenated blood from the mother is coming from the placenta, and there is no need to send the blood to the heart to the lungs. So it's from when the oxygenated blood is coming from the atrium to the right ventricle, is immediately the ductus arteriosus is immediately connecting the right ventricle to the dorsal aorta. Okay, it's a bypass and it will close up later. If it doesn't close up, it's a problem, because we don't need blood bypassing when it is deoxygenated. Right now it is bypassing because the mother is still giving the fetus its own oxygenated blood. Okay, so in later adult days, these ductus arteriosus have to regress or disappear and become what? Ligamentum arteriosus. Failure to do that, it will become a clinical problem. So the third arc artery, but I've told you that the first and second disappeared, leaving behind maxillary artery, and then we have the hyoid and stapedial artery respectively for the first and second aortic arc. Now I told you that these portions have disappeared, regressed. This one remained patent. The portion of the point of attachment of the left aortic arc, the dorsal aorta, and the branching off of the atria supplied to the board would remain patent on the left side to form the ductus arteriosus, that is for bypass of blood. The blood is not going to the lungs, it bypasses the lungs, right ventricle into the what? Dorsal aorta. So we have that the third and fourth arc arteries. What happens to them? The third aortic arc is gonna still be growing. It's gonna grow cranially. Why is it going cranially? It wants to form an arterial supply to the head, and this board is gonna give us what we call the external carotid artery. The third arterial arc gives off a board that becomes the what? External carotid artery. Both of them are going to be that. we have two external carotid arteries. So it is the third aortic arc that is going to give rise to the third aortic arc is going to give rise to this is the third aortic arc. This burden of okay. The dorsal aorta will still give off segmental branches from its body. This is a summary of the formation of the main arteries. If possible, you can screenshot these and make sure you commit them to memory. The ascending aorta is coming from the truncus arteriosus, and we also have another structure coming from the truncus arteriosus, the pulmonary trunk, truncus arteriosus. Remember, the sixth arc artery is going to open dorsally to this guy, truncus, to the pulmonary trunk. Okay, the pulmonary artery is coming from the sixth arc artery, going to open to the pulmonary trunk. Whereas this is what other arteries will open into the what ascending aorta. Look at it. This is the pulmonary trunk. The pulmonary trunk is dorsal, and the ascending aorta is ventral. This is our aortic sac. This is the truncus arteriosus, dividing into two to form the pulmonary trunk and the ascending aorta. The sixth arc artery opens dorsally. The third and fourth open ventrally. You have seen the reason. So the brachiocephalic artery is formed from the right horn of the aortic sac. Right horn of the aortic sac. How I remember this is that I know that the brachiocephalic trunk or artery is going to divide to give me the right superior and the left superior. So hence it should be the right. So I mean it's at the right side. Sorry about this. Alright. It's at the right horn of the aortic sac. And the right subclavian artery is going to come from the right fourth arc artery and seventh cervical intersegmental artery. Intersegmental artery. Okay. So this is something you have to really memorize, if I would say, so you understand it fully. Ascending aorta is going to be from the left dorsal aorta. Remember I told you the right will regress. So the left dorsal aorta and fused dorsal aorta. Yes. Some of this fused dorsal aorta is going to remain. So it's going to form the descending aorta. We don't want two descending aorta. That is why the right has to go. Right has to go. And the left becomes the patent one and gives rise to our descending aorta. The aortic sac gives our arc of aorta. Left horn of aortic sac gives the arc of aorta. Left fourth arc artery gives the arc of aorta. All this. Right fourth artery gives the right subclavian, 7 segmental also. Okay. Left subclavian from left 7th cervical intersegmental artery. Common carotid artery. Okay, this external carotid I told you apart from the third arc artery gives us this. Okay, and this guy is common carotid is coming from the proximal part of the third arc artery. So anything about third arc artery should be carotid, should be consonant carotid. Just understand or remember that external carotid is going to be from the bud from the third arc artery. The common carotid is going to be from the proximal part, that is the beginning part of the third arc artery. The internal carotid is going to be from the distal part of and this guy is going to bud off from the third arc artery. Okay, external will bud off common arc artery will be the probably continuation proximal part of the, and the internal cavity will be now be the distal part of the thoracic artery, and the cervical part of the dorsal aorta. Alright, so ductus arteriosus, I've told you this before. This is what you need to memorize. So developmental anomalies is due to the fact that some parts that is meant to disappear remain or persist, while those that are meant to persist disappear. You can see double arc of aorta, very bad. This should be coming from the left side, right? The arc of aorta should be coming from the left horn of the aortic sac. So if the right horn is there to give out this, it's going to be a double aortic arc, and we don't want that. And we have abnormal origin of the right subclavian artery, double aortic arc, patent ductus arteriosus. When the ductus arteriosus fails to close, it's a very big problem, because now when you are born breathing oxygenated air, the lungs become activated, and the oxygenated blood is going to be in your system. You don't have to bypass the lungs. So ductus arteriosus will mean bypassing the lungs. Hence, you are going to be mixing oxygenated and deoxygenated blood, which is very bad. That's patent ductus arteriosus. We have to close that patent ductus arteriosus. Persistent right aortic arc. You should only have the left one from the left horn of the aortic sac. If it's double, that means the right one persisted. Okay, that's a problem. Development of other arteries. Other arteries. The primitive dorsal aorta give off 3 groups of branches. The one that supply the ventral splanchnic derived structures. Okay, so they are the ventral splanchnic arteries, and we know that when we have splanchnic, we are talking of the fore, the mid, the hindguts, and what have you. Alright, we have the celiac trunk, the superior trunk, 3 persist, others disappear. But we have to know that we have the celiac superior and inferior mesenteric trunk. How do I remember this? Like I told you, the ventral splanchnic arteries are going to be supplying organs derived from the splanchnic organs. This is the guts. Okay, so you're going to have, and you know that the foregut is supplied by the celiac trunk. The superior mesenteric is supplying the midgut, and the inferior mesenteric is supplying the hindgut. Other remnants are the bronchial and esophageal arteries. We have the lateral intermediate splanchnic arteries. Intermediate splanchnic arteries. Intermediate mesoderm will give rise to kidney, the adrenal gland, the suprarenal gland, the phrenic, the diaphragm, part of the diaphragm though, and the spermatic or ovarian arteries. Remember, the intermediate mesoderm will give rise to the ovary, that is the gonads, to give rise to the diaphragm, give rise to the kidney, renal gland. So if you can remember that, so you know that the arterial supply of the intermediate splanchnic arteries should be going to these structures: kidney, the adrenal gland, the diaphragm, and the the testis, and the ovary. Or we have the lateral somatic intersegmental, lateral somatic intersegmental branch. They retain their original intersegmental arrangements. Alright. They are recognized as intercostal arteries. Intercostal. When you have intercostal, that means it's this guy is the rib, costa is rib, inter between ribs. Alright, so these arteries, dorsolateral, they are found in the dorsal back, laterally away from the midline. Okay, dorsolateral arteries, intercostal, and they divide into ventral and dorsal portion. The ventral portion is going to be supplying the limbs, the limb board. That is, when you talk about the limb, you're talking of your arm, forearm, your hand, your thigh, your leg, your foot. These are parts of your limbs, of the upper limb and the lower limb, okay, respectively. We have the internal thoracic artery, superior epigastric and inferior epigastric artery. Remember, I told you that is the ventral portion giving rise to internal thoracic, superior and inferior epigastric arteries. The dorsal division supply the muscles of the back. Right, dorsolateral, somatic, dividing into two to form ventral division, which will supply the limbs, and the dorsal division, which now will supply the muscles of the back and the spinal cord. They are connected to form anastomosis, okay, to form the precostal. When you have pre, that is before the ribs, that is in front of the neck of the ribs, in front of the ribs. They persist as thyrocervical trunk, descending cervical artery. If you can remember, these are the branches of the subclavian artery. So you see that these guys are coming from the precostal arteries. And superior intercostal artery. The superior intercostal artery is arising from the dorsal aorta. It's arising, sorry. Okay. The superior intercostal artery is arising from subclavian artery. Yes, it's arising from the thyrocervical trunk. It's a branch of the thyrocervical trunk. We have descending cervical artery. So we have postcostral behind the rib spots in front of the transverse process. So they form greater part of the vertebral artery. The post-transverse lie behind the transverse process. They remain as deep cervical artery. Seventh cervical intersegmental artery. This is the seventh cervical intersegmental artery. The seventh cervical intersegmental artery, coming off from here. See that it's coming off from the fourth aortic arc. It is the seventh cervical, and this is leaving the point of attachment and budding off. So this budding off now is the seventh cervical intersegmental artery. So the seventh cervical intersegmental artery is forming the main stem of the subclavian artery. Divides into dorsal division, ventral division, and lateral division. Dorsal means back. So it's formed the main stem of the vertebral arteries. Ventral in front, form the main stem of the internal thoracic artery. Right, the seventh cervical artery. And the lateral forms the arterial supply to the axilla and the brachial arteries. So this is the development of the vertebral artery, the first part from the origin of the